Thank you, Carly. Thank you, Lori, for being here. Can you give us a little bit of background about yourselves and how you got involved with Terumo?
Yeah, so I can start. My name's Carly. I'm an ICU nurse from Australia. Kind of fell into nursing. Didn't really know what I wanted to do when I finished high school. And mum's know best, right? Said, why don't you go into nursing? And my best friend at the time had just got into university through nursing. So I started my undergraduate degree and just fell in love with it. Um, Throughout my undergraduate degree and then when I first started nursing, I always had a passion for education. I was always the first one, when nursing students came through to spend time with them and explain different concepts. And so through that passion, through education, I actually moved after about 10 years as an ICU nurse into the commercial industry. So I started as a clinical trainer for Terumo Blood and Cell Technologies in Australia. And then I've been lucky enough with Terumo to live in both Singapore and Denver, USA, where I currently live now. So that's a little bit about my background and how I got into Terumo Blood and Cell Technologies.
And I'm Lori Harada. I've been a nurse for 40 years. Oh my God. And I started in ICU just like Carly did. I was in a general ICU, then an open heart unit. And a little bit of a sad story. My brother developed a cardiogenic sarcoma, and he was actually in my unit and had open heart surgery. I got to know his oncologist very well, and after my brother passed away, his oncologist came to me and said, "How would you like to run my apheresis department?" And I went, "Sure. I have no idea what I'm doing, but I'll try it." Like all nurses, we like to try new things, right? And I started the apheresis department at St. Louis University Hospital in St. Louis, Missouri. So I got that going and then learned from the industry, when they come in and train you on their devices. They approached me at the time, it was Baxter Healthcare. And I went to work for Baxter as a clinical specialist and trained on their devices for 11 years. And then I actually had my own consulting business for 10 years. I consulted on new product development and developing training materials for apheresis devices. And then when I moved to Denver in 2010, not Denver, actually, I moved to Western Colorado. I applied at Terumo, having all this background in apheresis, and they hired me. And now I'm the manager of a group of 12 individuals across the United States that train on all of our apheresis devices.
That's amazing. I love the background that you guys have and the stories to get you where you guys are today. So, what is Terumo Blood and Cell Technology?
So, yeah, we're a medical device company. Our headquarters are based in Lakewood, Colorado. And what we do is we produce products, services, and software that enable customers to collect and prepare either blood or cells to help treat challenging diseases and conditions. So, within our company, there are four business areas. We've got what we call our therapeutics area, and that's really focused on providing systems that provide therapies for patients, as well as collecting blood cells for different immunotherapy products as well. We've got our global blood services group, and that really focuses on solutions for blood banks, like collecting plasma, red cells, filters for red cells, etc. Then we've got our cell therapies area, and that really focuses on providing solutions to our scientific customers to automate their processes. And finally, our newest area is plasma innovations, and they really develop systems that innovate the plasma industry. So, we're really focused on really providing solutions to be able to get blood and cells to do more for patients.
So it seems
Yeah.
like the company is focused on everything related to blood, taking it out of the system, the human body, and then using those cells for any kind of research or any kind of way to maybe help somebody if they need a transfusion. platelets, things like that, correct?
Yeah. So, there's a couple of things. It might be removing something from the blood that's causing harm to the patient, and replacing it with solutions that will provide a substitute for that. Or to your point, it could be collecting cells for different therapies. So sometimes our cells are collected and they're put into other systems for expansion, like CAR T therapies. They're a lot of the bigger sort of things we do. And then I think the other thing that we do is provide solutions for blood banks to be able to collect blood products for infusions in hospitals.